Good morning, everyone. Scott Maybor here with your Medicare Missive from the pond for Friday, the 17th of October. Open enrollment has started, and I apologize. I haven't been doing as many of these lately because I have been so incredibly busy. It officially started on the 15th, open enrollment, that is, and it's just gone crazy since October 1st. Nuts. There's a lot of changes. I cannot encourage you enough to take advantage of annual enrollment and check your drug coverage if nothing else, but a lot of you are getting cancellation notices. A lot of you have changes to existing policies that will still roll over, but you may not have been paying a premium last year. Next year you're paying a premium. You have to decide, is that worth it or not? Extras like your dental coverage and your over-the-counter stuff is going away. I spoke to somebody yesterday. She's had the PPO. She's been very happy with it. Now she has to pay $50 a month for it. It has no dental, and it has $10 a month in over-the-counter, which is essentially zero. She's like, I really don't know that it's worth it. I agree with you. Other people are losing their Advantage plans, and in states with underwriting for the supplement, this is an opportunity to buy a supplement with no underwriting. So if you're not healthy and you're thinking, gee, a supplement makes sense, definitely time to look at a supplement. And you don't have to go with you could go with a lesser supplement if the budget's tight. The other thing, I spoke to somebody who told me she didn't need any help with her drug plan, and I said, that's fine. Totally up to you. She's going to let it just roll over. In her case, letting it roll over will cost her $500 more next year. Because the deductible is up to $615, the premium on her plan went up, so it's going to cost her $500 more than the plan I would recommend for her, but she doesn't want to work with me. She wants to do it on her own. Not a problem. She doesn't want to pay my fee. It's costing her $500. My fee in her case would have been $100. Whatever. That's fine. That's her choice, of course. Spoke to somebody else yesterday who the wife actually wants him on an expensive drug plan. His drug plan that he has now, it's technically being changed. It's technically being canceled because the carriers either changed their name, basically. The plan went from $25 a month to $65 a month, but it's not covering one of his medications. So he takes I think it's an inhaler of some sort that I've never seen before. Very expensive, and this plan doesn't cover it. The $14 a month drug plan does cover it. So in the case of the $14 a month drug plan, he's paying $14 a month, and he's getting all 5 of his medications covered, including this new inhaler. His net out-of-pocket for the year is around $1,100. If he switches to the drug plan she wants, which is she either stay with the one they have or go to a more expensive one, because she said, I really want to make sure he has a good plan. The plan that they're on will cost him $3,300 next year. It's $2,200. And she said, but is it a better plan? I'm like, not if it costs you $2,200 more. And for those of you who are saying, well, there's a $2,100 cap on drug plan out of pocket, yes, for covered medications. His inhaler wasn't covered, so it doesn't count towards the $2,100. It's $350 a month times 12 months. That's a lot of money. The rest of the drugs were cheap. So a more expensive drug plan doesn't necessarily get you more. A cheap drug plan may be the best option for you. There are 0 premium drug plans in many states, and in many cases that is the best drug plan for you. None of the drug plans pay commissions, or almost none of them. So it's really a matter of making sure you get honest help. There's fewer and fewer brokers willing to help people, which is what I predicted would happen. You start paying commissions, then the commission brokers can't make a living. Doing a drug plan review, depending on the number of drugs, is time consuming and comes with some risk. If there's no commission in it, why do it? In fairness to the brokers, if you're a commissioned broker, that's how you get paid. Well, there's no pay in it. It's literally doing it out of the goodness of your heart. And I see an increasing number of brokers unwilling to do that. So you either have to do it yourself through Medicare.gov. You can go to a Shine Ship counselor or volunteer at the senior center. You can work with a broker if you can find one willing to do it, or you hire someone to do it. And those are kind of your options. If you do nothing, you may be very disappointed come January 1st in the coverage you have. So I would recommend checking it one way or the other. Let me know if I can help. Have a great weekend. Be well. I'll try to be more timely with videos, but it's tough. Like I have 6 appointments between now and my 1 o'clock appointment, my lunch appointment. So be well, enjoy, and take care of yourself.